Good afternoon. Thank you for joining us again today. A few housekeeping items to go over first before we get to Dr. Box and all the health indicators that we need to go through regarding the last week and then looking forward a week. Obviously, it's race weekend. It is August, but it is race weekend, and you and I are both not driving, and we're not in the pit crew, so we will be, like, I hope 6.7 million Hoosiers watching at home, 2:30 on NBC, and we'll all be joining a worldwide audience that has taken in the race year after year after year. So a little bit different, but if you have friends and family over, obviously physical distancing, but let's root on our drivers this weekend. Also very pleased to announce that we have, and we're sending out the press release to all the schools and school corporations, the $61 million that I've talked about in the GEARS funding, that is on its way out to local schools and colleges and universities throughout the whole state of Indiana, helping with connectivity and with devices and with making sure that educators are skilled up to be able to use that technology. So that's $61 million into schools, and how schools, what was really kind of awesome to see was how schools came together in their application process. The DOE, the SBOE, and then CHE reviewed all those applications, and 670,000 students will benefit from this. 81 different Indiana counties took part in it. So Katie Jenner is here, my senior counsel for All Education Matters. She is here with us today, and Katie, you might elaborate on that in just a few minutes. Also on the education front, we announced several weeks ago that we were in the process of getting masks and hand sanitizer, but masks out to all the different schools throughout the state of Indiana. As of yesterday, all those deliveries are complete to every school that requested masks. So 2.4 million masks to 574 K-12 schools and school districts all across the state of Indiana. And again, that was masks and hand sanitizer. That's all out the door and to the schools. Also, wanted to give an update. Fred Payne is with us, the commissioner of the DWD, is with us today, and he can elaborate on this. But we did make application to FEMA for the new Lost Wage Assistance Program. We elected to go the route of the $300 per week with our federal partners for unemployed Hoosiers who are eligible. These payments are retroactive to August 1st, and of course they'll be temporary. They set aside $44 billion, and so as that is drawn down, that program could end accordingly. So Fred, you might want to be on the ready to respond to that application going out earlier this week. And we'll also have Jake Sipe, the executive director of our housing authority, and he'll give updates on rental assistance. But before we get to Katie and Jake, we'll start with Dr. Box.
Thank you, Governor. Good afternoon, Hoosiers. Today we reported 506 additional cases of COVID-19 in Indiana, which brings to our total 82,336 the total number of Hoosiers known to have COVID. We also saw 14 additional confirmed deaths. To date, 2,968 Hoosiers have died of COVID-19, and another 212 are believed to have died from this disease based on their clinical diagnosis. Statewide, our 7-day positivity rate is staying relatively stable at 7.7%, but unfortunately, we're not seeing the decline that we would like to see. Currently, nearly 35% of ICU beds and more than 81% of ventilators are still available. About 11% of occupied ICU beds are housing patients who either have been diagnosed with COVID or have symptoms of COVID. 3% of ventilators are being used by someone who has COVID or is suspected of having it. We also have seen more than 934,000 Hoosiers tested for COVID-19, up from more than 867,000 a week ago. Our partners at Regenstrief have looked at 80,373 cases to date. Of those, about 22% visited the emergency department, which is what we've seen in our recent weeks. A total of 10,037 were hospitalized, which represents 12% of all positive cases. That is down slightly from last week. Of those who are hospitalized, 21% were admitted to the ICU, which is consistent with what we've been seeing. That represents 3% of all positive patients. 76% of hospitalized patients have been discharged, which is an increase from 72% last week. Of the remaining 24%, 6% are believed to be hospitalized, 18% are known to have died while hospitalized, and Regenstrief also estimates that 77% of patients have recovered. While we've been able to maintain stable ICU and ventilator capacity, our hospitalization numbers are still well above where we were at our low point in late June. Throughout this pandemic, we have worked to improve our data and add to our dashboard what we can share publicly. To that end, I want to share some changes that we will be making to how our positivity rate is presented on the dashboard. Historically, we have calculated our positivity rate based on positive tests among unique individuals over overall tests on unique individuals. That means that if someone is tested repeatedly, we only counted that person once. This was the right approach at the time because early on, we weren't seeing people tested multiple times. This has changed. The information we have gathered throughout this pandemic has been incredibly valuable, and we will continue to show the percent of positivity calculated this way. Additionally, however, we will calculate the percent of positivity based on the total number of positive tests divided by the total number of tests. This will give us additional insight into our community spread and allow us to compare this metric to other states who are also using this method. What's important to note is that the positivity trend is the same for both methods. Whether the percent of positivity is decreasing, increasing, or staying the same remains consistent. It's important to note that the CDC doesn't tell states how to calculate the positivity rate. We've used the method that you've seen reflected on the dashboard, but we want to be transparent and share as much data as possible. As we've observed the metrics other states are sharing, we saw that adding this additional calculation will allow us to more accurately compare ourselves to other states. I also want to talk about some of the different types of tests being done for COVID-19. When we first started, the only approved test to diagnose active viral infection was the PCR test, which identifies the genetic material of the virus. Since then, an additional test to diagnose active infection with COVID-19, called an antigen test, has become widely used. These antigen tests check for a protein on the outside of the virus. Both of these tests can be obtained with either of our nasal swabs, which we've talked about multiple times, and both can either be sent to the lab for analysis or can be run through point-of-care testing while you wait. Historically, we have only included PCR tests on our dashboard because the CDC's definition of a COVID-19 case included documentation with the PCR test. Now the CDC recognizes the need to document a case of COVID-19, also using the newer antigen tests. We have been doing contact tracing for positive antigen tests reported to us since the end of July. Beginning Monday, we will be including all positive and negative antigen tests submitted since the end of July on our dashboard. Over the next month, we will enter our historical negative and positive antigen tests. These historical results will not be included in the total positive cases and total tests will be included, in the total positive cases and the total tests done, but they will not be counted as the new test in the daily update. So that way we will not skew our positivity rate. I also have an update on our efforts to better capture how many COVID-19 cases are associated with schools. Last week, in our school webinar, we opened a new online reporting tool to help schools more quickly report close contacts of a positive case. I mentioned last week that we've been working for several weeks to get the school rosters that will allow us to match positive cases to students. We're making progress in getting all the data we need to create a dashboard. As of last week, we had between 20 and 30,000 student records. Yesterday, we received access to 500,000 records from the Indiana Department of Education, and more are expected in the future. Having these records will help us quickly match positive cases among students to schools and ensure that schools and local health departments are notified promptly. We are also building a portal to capture positive cases among students, staff, and teachers, and will ask schools to update that every 24 hours. All of this data is coming together for us to build a public-facing dashboard that truly reflects the prevalence of COVID-19 in our schools. My goal is to have that available by mid to late September. Having this information will help better inform how our schools are being impacted by COVID-19 and may help guide districts to guide their operational plans. I also want to emphasize how important it is for people to complete their quarantine and isolation period and to avoid going to school during this time, to avoid going to extracurricular events or to practices if they have symptoms and are waiting test results. Or if you're a close contact of someone who has tested positive, you need to stay home for 14 days of quarantine. We've had a number of cases in our K-12 schools recently where COVID was brought into the school by people who participated in an outside activity, such as a party or a large gathering. This has resulted in more than 100 students being identified as close contacts in one case and led to quarantining of entire football teams or dozens of teachers in a school building in other instances. I cannot say this enough. The actions that you take outside of school are just as important as those that you take inside the school building. Please don't put yourself at risk of being isolated or quarantined. Follow the guidance that we've been sharing for months. Finally, I want to continue to encourage parents, schools, and local health departments to partner together to help identify those close contacts and prevent the spread of COVID in our school settings. This is an incredibly challenging time for our educational system, and I know it's chaotic for parents trying to plan whether the child who goes to school in person today might have to switch to virtual learning tomorrow. We're going to be on this roller coaster for a while, at least for the foreseeable future, but we can all help make it a smoother ride if we respond to the contact tracers, if we wear our masks, stay home if we're sick, and wait on our test results. Thank you.
Thank you, Dr. Box. Katie, you want to go into more in-depth on the GEARS grant dollars?
Sure. Good afternoon. As Governor Holcomb shared, today we are very pleased to announce the recipients of the Governor's Emergency Education Relief Fund, which will provide over $61 million to Indiana K-12 schools and higher education institutions. This GEAR funding, as it's called, was established by the Federal CARES Act. Indiana's GEAR funding will support improved connectivity, an increase in devices for students and teachers, as well as the creation of training opportunities and curriculum development to strengthen the quality of K-12 remote learning. Before going any further, we want to thank the Indiana Department of Education, the Indiana State Board of Education, and the Commission for Higher Education, who worked together collaboratively to review all applications. In this competitive grant selection process, they used a rubric that focused on the applicant's local or regional plan, partnerships and sustainability, as well as a needs and equity analysis. Award recipients proposed detailed plans that include the purchase of student devices ranging from Chromebooks to iPads, new or upgraded laptops, MacBooks, Chromebooks, etc. for our teachers, and innovative connectivity solutions, including cellular MiFi devices, expanding Wi-Fi access to key community locations, and more. These grants will fund a minimum of 68,000 student devices, 2,800 teacher devices, and over 85,000 connectivity solutions. The team reviewed some excellent applications. Some highlights include county-level partnership between traditional public, charter, and non-public schools, partnership between Indiana higher education institutions and K-12 schools to improve educator and parent training opportunities, and plans for connectivity solutions strategically focused on locally identified children who may be learning from home without access to internet. There are over 674,000 students who attend the schools selected to receive this funding. Grant awardees include 184 traditional school corporations representing 1,366 schools, 64 public charter schools, and 124 non-public schools. Additionally, 12 Indiana institutions of higher education will receive grant dollars. This money will fund specialized training to better support parents and families, as well as professional development for educators to strengthen remote instruction, support students with special needs, English learners, and provide social emotional learning resources during remote learning times. These resources will be made available at no cost to Indiana teachers. We want to offer a sincere congratulations to all Indiana schools recipients, and most importantly, for the locally driven, targeted plans you provided to positively benefit our Hoosier students and educators. Congratulations.
Thank you, Katie. Jacob Sight, you want to give us an update on our rental assistance program?
Yes, thank you, Governor. I'd just like to provide a quick recap on Indiana's rental assistance program. The program opened and began accepting applications on July 13th, and it's for renters whose current income is lower than it was on March 16th due to COVID-19. And it's for Hoosier renters outside of Marion County, because Marion County has a separate rental assistance program, and I'll provide a little bit more information on where to locate more information on these programs in just a second. The Indiana's rental assistance program makes payments directly to our landlords on behalf of their renters, and we can provide up to $500 per month for 4 months, up to $2,000. Information for renters and landlords outside of Marion County may be found at indianahousingnow.org. Information for Marion County's renters may be found at indyrent.org. The data you see here on this slide is a week-by-week breakdown of the number of applications that have been submitted through Sunday, August 16th. More than half of over 30,000 applications we have received were submitted in the first week. Since then, we have received around 3,000 to 4,000 applications per week. At IHCDA, we are working with multiple statewide partners, and we're very fortunate to have 20 members of the Indiana National Guard who are also assisting with the application review process. These partners and the team at IHCDA, this has allowed us to expedite the review process. However, due to the high demand, it may still take us about 7 days from the time a renter applies until they are contacted by a member of our review team. Now, participating landlords began receiving payments during the first week of August, and currently more than $7 million in rental assistance has been sent to participating landlords on behalf of renters. Now, I want to talk about the process, and specifically I want to talk about the process for our landlords. Once a renter submits an application, additional documentation is needed to verify program eligibility. IHCDA will directly send an email to the landlord informing them they have a renter who has applied and may be eligible for assistance. And we will also send our landlords the documents that they need to complete. The sooner our landlords complete the documents and return them back to IHCDA, the quicker we can make the rental assistance payments. So if you are a landlord and you are aware of a renter who has applied for the rental assistance program, if you have questions, if you haven't received an email, then please feel free to email us at raf@ihcda.in.gov. The application portal, again, may be found at indianahousingnow.org, and that's for our renters and our landlords where they can upload their documents. Any renter in need of assistance that has not yet applied has 1 more week to do so. The online application portal will close at 11:59 p.m. Eastern Time on Wednesday, August 26. A reminder that this program is for households that rent their home and live outside of Marion County. Before I go, Governor, I want to remind Hoosier homeowners that there is a mortgage payment assistance program available, and it's through our Indiana Hardest Hit Fund, which helps Indiana homeowners who have fallen behind on mortgage payments or cannot make future payments. And if you're in this situation, you should go to 877gethope.org or call us toll-free at 877-GET-HOPE. Thank you, Governor.
Thank you, Jake. And Rachel, we'll go right now to the Q&A portion.
Adam Van Osdol, Hannah News.
Good afternoon, Adam. Thanks for joining us.
Thank you. Seems like our numbers are still a little bit low. Are you okay with where the level is at? And like, what's your goal for where you like? What number would you like to be at level to be at? Thank you.
Could you repeat, Adam, the first couple sentences? I could hear you say, are you comfortable with where we're at, and what would I like to see, but I didn't understand what you were referring to.
Yeah, our level of COVID-19 testing. What number would you like to see at?
Yeah.
Thanks.
Thank you.
Our testing looks low today. Our total tests were about 9,000, but unique individuals only about 5,900. We typically see that on Wednesdays. I think there's a catch up from the weekend, and then Wednesdays there's a little bit of a lull. That's been traditionally the way it is. I would really like to see us up around 10 to 12,000 tests a day, to be honest with you.
Angelica Robinson, Wayne TV.
Good afternoon, Angelica.
Good afternoon. A couple of questions here. We're seeing a sharp rise in cases in Adams County, and officials there have issued a stricter mask mandate. At this point, though, there's no real penalties for people who aren't wearing masks. Are you guys considering penalties or shutting down businesses that aren't complying with your statewide mandate or local mandates? And then also, if there's any thing that you guys can talk with us about the work you've been doing in or with Adams County officials to identify those positive cases and keep those numbers down.
You want to take the second part, and then I'll take the first part?
So I know my team has been working with Adams County, and I don't think they've identified a specific issue there at this point in time. So they are looking further into that right now. I know that there have been some testing that has been done with some migrant workers in that area, but I don't think we've identified a specific issue. But that is ongoing, and we will certainly give you a report when we have that.
And Angelica, we'll continue to work with locals on the education front. We have not considered more enforcement for not wearing a mask. We're relying heavily on local enforcement. Another thing that I've seen work in other parts of the state and country, for that matter, and world, is a lot of signage, just underscoring the importance, whether it's on Main Street or at work, at school, just making sure the word gets out that this is how we can, one thing that we can do of many to slow the spread. And so we'll continue to do just that. It obviously, Adams County, it moves around the state, and we want to make sure that, as Dr. Box articulated in her opening comments, that we're physically distanced, that we're masking up, that we're practicing good hygiene, all those things that we can control to manage our way through. And by the way, what we're seeing are a lot of businesses and employees going back to work in the state of Indiana. As we look at mobility patterns, as we look at, Fred, you might want to comment later, as we look at our unemployment numbers, people continue to go back to work. So we figured out how to safely work, and that will continue. And obviously we were at a very, we were at our highest. It was adjusted up to 17.5% unemployment. It's been going down, 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 down as people go back to work. So just underscores, Angelica, the importance that as that occurs, we do it safely, including at school.
Whitney Downard, CNHI.
Good afternoon, Whitney.
Good afternoon. I have a question for Dr. Dan when it comes to inspections specifically. CMS allowed comprehensive inspections to start up again. Why, kind of before the pandemic began, 40 plus homes hadn't been comprehensively inspected for 18 months or more. You know, do we not have enough surveyors going into these homes? Kind of what's the problem, and why aren't we getting those surveys done on a timely manner?
That sounds like a loaded question, Dr. Dan.
And we can get more information to you from the folks who oversee the survey program with ISDH. Let me clarify a couple things in the sense that from the beginning of the pandemic, while the surveyors were didn't have to, or CMS had suspended traditional surveying, it's not that they weren't in the facilities. Our surveyors were part of strike teams, and they were actively calling and going to facilities around the state from the beginning of the pandemic, particularly when there were outbreaks. I know early on in March, we had surveyors that were at every facility or in contact with every facility to review their infection control plans. They've been doing surveys the whole time throughout this. Now, they weren't doing, I think, the traditional CMS surveys and some of the ICAR surveys, but they were in facilities helping along the whole way. I think we have plenty of surveyors, and I know that they're currently actively surveying, but if there are specific numbers that you need, we can certainly get those to you.
I do know that there was a time period when the CMS has to train all the surveyors, and you had to actually go to Chicago or DC and other places to get trained, and they were very behind on training. So I know that they do that virtually now, and that has really tremendously helped states to increase their workforce.
Thank you both.
Steve with KPC Media.
Yep. Afternoon, Steve.
Good afternoon. How are you doing today?
Very good, thank you. Yourself?
Good, good. Two questions, one quick one and one more involved. Dr. Box, with the new positivity rates that you guys are going to be crunching, does that take into account all positives or just unique positives? For example, if somebody was retested multiple times before, say they're moved into a rehab program and they've shown up that they're still actively infected, would that be counted, or are we just looking at unique positives?
Nope, we're going to do all positives over all tests.
Okay. And then my second question is regarding contact tracing. I know a couple weeks ago you said about 20% of people weren't responding to contact tracers at all, but I've heard some other reporting from other states where with contact tracing, the level of information that they're getting is sometimes less than they're looking for, that people may say, I was at a party, but then they don't want to tell contact tracers, people that they know who were there, give them phone numbers and things like that. So can you talk to me a little bit about the quality of the information that we're getting from contact tracing? And is there a way to quantify whether we're getting, mostly the good information that we're looking for, or, do some people pick up the phone but then say, no, I'm not going to give you anything? Do you have any kind of breakdown on some of those things?
Right. Because we are using the automatic text and then the call if people don't reach back to us, Indiana is reaching a much higher percentage of people within a short period of time. Do those individuals always give us the data that we want or the contact information for their close contacts? No, some of them are not comfortable with that. Some of them will name contacts but don't want to give us a way to reach them. So what we have been doing is asking those individuals to please take our number and information and give it to those close contacts and have them call us. That way they don't feel like they gave somebody's personal information out. We have run into similar issues. I can bring more up-to-date data next week and report that out for you. Have a slide on that next week.
Stephanie Wade, WRTV.
Good afternoon, Stephanie.
Good afternoon. Can you hear me?
Crystal clear.
Okay. So my questions revolve around the election. Several states have laid out their full election plans, whether it's on-site, mail-in voting, when you have to have your ballot mailed in by. Where is Indiana in releasing our plan? And my second question, just today, the Hamilton County Clerk sent out a press release to us encouraging people to register now for absentee ballots so they're returned in time. She said they've received many calls from people concerned about the post office and its ability to get the mail-in ballots returned in time. Is this also a concern to you, Governor? And what can you say to people to make them trust and feel that their vote will be counted this year?
Well, don't procrastinate. I mean, we've got, first and foremost, we've got it's a month leading up to that final opportunity to cast your ballot. So there are multiple 28 days in advance opportunities to be expressing your voice. And I would encourage people to do it sooner rather than later, just for the very reason that folks might be concerned. Now, having said that, I'll continue to obviously work with the Secretary of State and the Election Commission, but our plans for how to express your vote is exactly as it has been advertised to date, and that is you have opportunities to vote absentee, you have opportunities to vote in person early, you have opportunities to vote in person on Election Day. And so multiple shots on goal here. And if you, as I said last week, a couple weeks ago, and 3 weeks prior to today, if you are ill, if you are away from home, if you are over age 65, there's a list of reasons how you can vote. Request an absentee ballot and vote early. And I would encourage people to do that. There's a lot of interest, I understand, in this year's election, and I hope more people vote than ever before.
Michael, WBEZ.
Good afternoon, Michael.
Good afternoon, Governor. And you were just talking a little bit about the subject that I was going to ask you about. Since Indiana's advice since this pandemic started has frowned upon large group gatherings, isn't that what could happen, though, with all the issues surrounding mail-in voting, problems with the U.S. Postal Service, and this early deadline for mail-in ballots to be counted? This could force people to just want to vote in person as to not be disenfranchised. You were talking a little bit about that, but perhaps you could expound a little bit about some of those issues.
Sure. No, I don't think so. I think a vast majority of folks that I hear from want to vote actually in person, and thankfully we had a Exhibit A, the primary election, where we proved that we could do it safely. So we've seen this unfold before recently, and that was when we were contemplating and coming off the heels of a stay-at-home order. And as I mentioned earlier, our mobility patterns and people are going back to work now more than ever since March. And so we've proven at the polling sites, if anything, we need more polling sites than we had in some places in the state of Indiana to disperse that number. But having said that, I voted in person, and it could not have been safer. And as I mentioned before, we don't know of any cases. Obviously, we've had large gatherings outside where people were almost on top of each other, moving in large groups, and we didn't see spikes come out of that. So I'm not advocating for that. Obviously, when you go to a polling site, we were spaced out. When I stood in line, we were spaced out by more than 6 feet, and everyone had a very sunny disposition. So we did it once, we can do it again.
Abdul Hakim Shabazz, Indy Politics.
Good afternoon, Abdul.
Good afternoon, Governor. A couple questions on special session. The Black Legislative Caucus, some of the ideological, more right members of the General Assembly, the Attorney General, I believe the Superintendent of Construction, have all won a special session for one reason or another. Once again, where are you with a special session? And number two, your thoughts on the possibility of, if lawmakers come back in January, if they do come back, holding the legislature over at like the convention center or perhaps Lucas Oil to properly social distance and do some of those other things? Well,
with all due respect, thanks, but no thanks to your first question. And the second question, I have a lot of confidence that the legislative leadership, on both sides of the aisle, by the way, will come to a good, safe alternative on how to meet. It's their decision. They'll determine that. I've been doing this safely since March, but I'm just one administration, and we can control how many people are in here. We don't have 150 people in one, 100 in one chamber and 50 in the other. So, yeah, I mean, we're all having to adjust how we manage our way through this, and we're no exception in this building. So, like I said, I have a lot of confidence that they'll come to a good landing spot, and if they need our counsel from the Department of Health perspective, we're happy to give it.
Max Lewis, WSBT.
Afternoon, Max.
Good afternoon, Governor. Can you hear me?
Perfectly.
Okay, perfect. Both of my questions are probably more so for Dr. Box, but I wanted to know, just up here with the situation that I'm sure you're aware of at Notre Dame and the sort of big spike in cases, I was wanting to know how concerned, if at all, are you that what's happening could happen, in Bloomington, West Lafayette, Muncie, Indianapolis, and so on. And then I have another question.
So I absolutely think it can happen, and I think it's a perfect example of what happens outside the classroom, outside the lab, outside in instruction. That is what affected all this. I mean, it was a big off-campus party that students attended, and a lot of students got infected. And those are the kinds of things that the risks and benefits that students are going to have to weigh if they want to have in-person instruction, be on campus, and get their education. Then there may have to be some changes in the social life.
Yeah, and I would just add, but Max, before you get to the other question, I would just, obviously Father Jenkins, Notre Dame made the best decision for students, for faculty, for campus personnel. And key word here, and I'll use it again, is making adjustments. And we're having to make these on the fly in all walks of life. And our universities and colleges, schools, having options in place and having a protocol that's very easy to follow, that roadmap. Kudos to Notre Dame and the leadership there for being able to not just be nimble, but be very thoughtful and thorough about how this process unfolds. And your second question.
If I could ask just a quick follow-up to the first one. As far as, Dr. Box, do you agree with the health department's decision? Because Father Jenkins had said that he was fully prepared to send students home. And the health department, the St. Joe County Health Department, said they think that, things can be under control. Do you agree with that decision?
I think that was a good decision. The local health department there is excellent. I know both of the physicians that are very actively engaged. They've been actively engaged with Notre Dame in contact tracing and testing from the very beginning. So for several months now, Dr. Fox has been working with Notre Dame. So I think that they came to a mutually good decision, not only for the health and safety of the students, but for the staff and the faculty there also.
And then I promise this will be the last one. But as far as testing, Notre Dame is publicly reporting their numbers and, working on getting those sort of communicated with the local health department. Is there a statewide policy, for all the other campuses as far as testing on, are they required to report to the local health department? Are they required to report to you guys? Is there any sort of policy on that?
We certainly have had multiple discussions about this. With regards to anybody that's symptomatic, so any screening tests that they're doing because somebody has symptoms, obviously any positives, they are obligated to report, not only to the university, but also to report to the local health department. But also we are working with them to get them to report when they do some type of screening testing, as they're just surveilling their students to see what the positivity rate is. And we'll be working with them and have been working with them on that.
Brandon Smith, Indiana Public Broadcasting.
Good afternoon, Brandon.
Good afternoon, Governor. First, I have a question for Fred Payne.
Okay.
On the application to FEMA and all that, the eligibility requirements for people to get the extra $300 benefit says you have to already be getting at least $100 in benefits. First, I want to confirm that that's how it's going to work for Indiana. But also, do we know a percentage of how many unemployed Hoosiers are getting less than $100 and therefore won't be eligible for this boost? And then I'll have a second question.
Yeah, and Fred, if you would, in addition to his two specific inquiries, also talk about what you have to build to accommodate this $300 extra.
Okay, yes, one of the requirements is that an individual has to be earning or eligible for a minimum of $100 for an approved unemployment insurance program. That includes our state benefits program as well as the federal programs. And right now, off the top of my head, I cannot tell you the percentage of individuals who do not meet that requirement, but it is a smaller percentage. In terms of what it takes to build this system, upon approval from FEMA and upon us actually receiving the funding, part of that is building a new system. As you may recall, back when we started our pandemic mitigation back in March, we had to build several new systems to accommodate these federal programs. This is also another federal program, but this program is actually run through FEMA, not necessarily directly through the U.S. Department of Labor. So it's going to take a little bit of extra effort on our part in terms of moving staff to build a new system, and that system requires us to look at some new infrastructure. So it will take somewhere between maybe 2 to maybe 4 weeks for us to get this in place and for us to start making payments.
And then Fred, before Brandon, you get to your second question, you want to talk about that $44 million and how long that may or may not last, considering other states are starting to weigh in just like we did.
Right. As of now, there are approximately about maybe 10 or a little less than 10 states that have actually applied, that are going to be a part of the program now. That number is growing daily. The total dollar amount that's available for this program under FEMA is about $44 billion. And this program will continue based upon the first of three things happening. Either one, the funding is deplete. Two, Congress enacts legislation that supersedes it. Or three, the total amount of funding for disaster relief reaches about $25 billion. So the first of any one of those things that occurs will end the program. Now we're talking about potentially maybe 50 states being involved in the program. And when you look at the total dollar amount that's gone out state by state, that money could go pretty quickly. As you may recall, last month we reported about $4.6 billion being paid out under our insurance, under our unemployment insurance program. We are, teetering around about 4.8 billion that we've paid out totally, inclusive of state and federal dollars. But the way that FEMA is administering the program, states are required to submit information and request for payments in first a 3-week increment. So we can get approval for 3 weeks, and then we would have to reapply every week thereafter until funding runs out.
And just, Brandon, you honed in on the $100, but Fred, our average is about $285.
Right.
So it could be potentially 300 plus 300, 600 a week.
Right. The average Hoosier is getting close to around about $280 on regular unemployment benefits. So add that plus the $300, they could end up getting anywhere from about a little bit less than $600 a week per person.
You had a second question, Brandon. I added 3 more on to yours.
Yeah, so back when Indiana first started getting the CARES Act dollars, you announced a task force that would oversee, administer, and account for all of that relief. There's 7 people on that task force. 5 of them are men. All of them are white. Since you've been talking about it lately,
I'll stop you right there, Brandon. That's incorrect.
Yeah, the group, so you've added more people to the group?
No, not all of them are white.
Okay. I just wanted to make sure.
We'll send you the list, but please don't forget John Thompson. He's on the IEDC board and serves on this task force as well.
Okay, I was looking at the original press release, which didn't include John.
Yeah.
So that's my mistake. But how are you ensuring that these CARES Act dollars will take into account these principles of equity inclusion that you're now talking about?
Well, that's exactly in part what the board does, the task force does every time they meet and make decisions about how these dollars get allocated. Chris, you might want to comment on this, but in terms of specific programs that minorities are specifically eligible for, this is why when we sent $30 million over, we carved out $5 million as an example for minority-owned businesses to only be able to take part of. And obviously, with our new CEIOO officer that will come on board, they too will not just look at CARES Act dollars and allocations, because obviously this is going to help us, just as the Next Level Jobs programs, how we're focusing on that $50 million that we moved over into job training. We're going to be seeking to make sure more minorities are taking part of these grants themselves, whether they're employers or employees. So it's the way that we ensure it is we be very transparent about it, and we hold ourselves accountable, and we share how we're doing. We measure it and share it. And for that matter, I suspect we'll be proud of the results.
Yes, and Chris Johnston from the Office of Management and Budget. I guess I would simply add is what the recovery team looks at are statewide programs for all Hoosiers. And these have covered, last week we talked about the arts and cultural events across the entire state. We've talked about support for nursing homes. We have provider sustainability programs for the aging and for the disabled. And so across the workforce programs, again, the only thing I could say is that these programs are statewide and to benefit all Hoosiers.
Yeah, and partly, Brandon, this is also why we devoted $500,000 to the Indiana Black Expo, because they have a network statewide that they can help us bring about awareness in minority communities themselves. So this is something that is just part of our DNA here, all of us across the board.
Brenda with Western Wayne News.
Good afternoon, Brenda.
Good afternoon. I have a few questions here, but I will try to keep it down. Regarding the GEARS program, did every school that applied get some of that funding? And if not, what kinds of criteria did they fail to meet?
Great question. And Katie is scurrying up to the podium. And it was 81 counties, right?
Right. So thank you for the question. Every county, actually I should back up, every school in the state was eligible to apply. So regardless of their traditional public school, non-public school, or charter school, everyone was able to apply. We had applications representing 84 of the 92 Indiana counties. And again, the review team was the DOE, the State Board of Ed, and the CHE, and they awarded based on a rubric that included an equity index. To the last question, it included the local need, et cetera. But 81 counties received funding. So there were some that did not receive funding who applied, but really covered the state in terms of geography, in terms of rural, suburban, urban. Just, again, excited to get those names out to you soon.
But there's no criteria that you can specify that was kind of an overarching?
Yeah, I can. Actually, if you go to the Department of Education website, the application is on there. If you scroll to the end of that application, there is a rubric, an evaluation rubric in Appendix C, and it covers more details than we have time for, Governor, in this press conference, but it's very, very detailed and should answer any question you might have. And if you have additional after, glad to talk to you further. But it's very, very detailed in terms of the rubric used.
So Brenda, are you scratching at the folks who did not become eligible, understanding why they were not eligible?
That is exactly, yes.
Okay. You can circle back with Brenda on that.
Yeah, I'm glad to.
And
But
walk through.
take a look at that rubric, and then glad to talk to you.
I got you.
Okay. One other follow-up question to that is just that I was wondering if we could get a breakdown of the number of institutions and students and teachers served between public and either non-public or charter.
you've got that.
Yeah, we have that, and again, let's connect after this, Brenda, and glad to talk through more details.
Okay,
Thank you.
I have one more question, if you don't mind.
Yeah, and just Brenda, there were 1,366 schools, 64 public charter schools, 124 non-public schools that Katie touched on at her presentation, but she can go deeper into that school makeup county by county with you after this.
Great, thank you.
Yep.
My final question is just about the nursing home numbers that are posted on the website, and I did notice that for those that we monitor each week, there were 4 of those that the numbers were reduced in the number of cases, not by significant numbers, but I just wondered what the reason for that was.
Can I have you ask that question again? I was trying to follow along, but I don't know that I did.
Okay, sorry. We monitor a few of the nursing homes in our area, and we did notice that some of the numbers that had been reported from the previous week were lower this week, and so I just wondered if there was something, maybe they were being counted differently than originally.
I don't know. If you don't mind, if you can send us those facilities and emails, we can look into that to make sure that there's not an issue with the way that we're counting those. I have not heard of that, but we'll certainly be happy to look into it.
Stephanie with Chalkbeat.
Good afternoon, Stephanie.
Hi. Dr. Box, can you clarify how you're able to match positive test results with student records to notify schools without violating FERPA or HIPAA privacy rights? And also, can you give more information on what kind of information you plan to make available on the public dashboard of cases in schools, like the level of granularity or the demographic groups?
Sure. So we looked at this very carefully with our legal team, and what we're doing is getting information from our Management Performance Hub, which Department of Education has already normally shared that data with them, and then we're crossing it with the NBS positive cases that we have. When that gets crossed, or we look at those two together, names of students and the schools that they're attending will fall out. Then what we will do is actually, through our portal, ping that particular school to actually go to log in their health nurse or their assigned person for that, and they will be able to get in and to determine for sure that that student has actually been in school, been involved with extracurricular activities. And in a situation of a pandemic and the issues with contact tracing, this is all within the limits of being acceptable, obviously. When we look at the portal, that portal that they report into will have basically teachers, and it will have staff, and it will have students. And when we report that on a dashboard, it will simply be a number of students, teachers, or staff for each of those schools.
Chris with WDRB.
Good afternoon, Chris.
Good afternoon. Thanks for taking my questions. Going back to the unemployment supplement program, 2 questions on that. I understand that you are not going to provide the $100 state match to put it up to $400. And I was wondering if you could comment on your decision-making process on that, considering that I understand you could use your CARES Act money from the federal government to provide that extra 100. And then this is really in the weeds, but I also understand there's an issue where you might not be able to pay pandemic unemployment assistance claimants this extra money because of how much you pay out in regular UI and there being a match for that. So I just want to confirm that everyone who gets at least $100 a week would be eligible. Finally, I have a totally unrelated health question for Dr. Box, if you have time on the other side. Thank you.
You want to take the first 2?
Sure. One of the reasons that we went this route was we did an evaluation of our economic situation at this time, and we determined that the best option for us at this time is to provide the $300 option, federal option. In terms of whether or not these benefits would be available for those individuals who are receiving PUA and the other federal fundings for unemployment insurance, they are eligible. Again, the eligibility requirements are that individuals must be eligible in receiving at least $100 in weekly benefits under approved UI programs. That includes their state programs as well as the federal programs.
Yeah, and are there any confirmed that have gone the 400 route? I know there's some considering it, maybe 2 or 3 considering.
None have been confirmed so far. There are some who are considering it. And we'll probably see that change as time goes on, because many states are in different positions in terms of how their unemployment is going up and down, just like ours. And this is kind of going a little bit above and beyond what you asked me. But as we reported last week, we saw about 11,000 initial unemployment claims filed. That's a continued downward trend of the number of unemployment claims we're seeing filed, which lets us know, which is one indication that more people are returning to work. And our state unemployment rate has dropped down from 16, it was adjusted up to 17, all the way down to 12 and to 11. And we'll probably see another drop in that when those numbers get released again for July. So I just wanted to make sure that we understand the perspective of how the different states, in particular Indiana, is doing in terms of unemployment.
So, and we're past mid-month, so you're expecting that update later this week, next week?
We should, yeah, those numbers should be released on Friday.
Okay, perfect, yep. And you had one for Dr. Box, I think?
Yes, I'll try to make it very quick. Sure. It looks, if I'm reading your dashboard correctly, your 7-day average positivity rate has been really steady, right around 8% or a little below 8% for the last month and a half. In Kentucky, officials started really becoming alarmed when the positivity rate went over 5 and they enacted additional restrictions on bars and restaurants. I'm just curious, what level positivity rate do you consider acceptable, and what would it need to go to for you to consider more restrictions?
Chris, I'm glad you asked this question for Dr. Box. And could you also talk about what I always bring up, the apples to apples and oranges to oranges, and how we're looking at it? And what kind of, you went over this at the outset about what is in our positivity rate and what is in theirs.
Right. I think it's an excellent question, and this is part of the reason we actually looked at all of our surrounding states, Ohio, Michigan, Illinois, and Kentucky, and everyone is calculating their percent positivity with the total positive tests over the total tests. If we calculated our our percent positivity today with total positive test over total test, it would be 6.5%. Am I happy with that? You know, I'd like it to be 5 or below. I think that we were there for a little while, and that is ideal. And that's part of the reason we haven't gone beyond stage 4.5, and that we've stayed where we are and continued to talk about the important things that need to be done in order to not have this rate increase. I'm pleased that it has not gone up, but I am very much looking and working all over the state with different counties that have percent positivities that are not related to congregate living issues or low numbers of tests that are being done. And we're using a lot of different metrics to talk with counties about where they are. And going forward, that'll be a really important part of the discussion.
Thank you for joining today's briefing. Governor Holcomb's next briefing will be next Wednesday at 2:30 p.m. Eastern.